When people actually talk in network settings outside of line management, usually it's kind of middle and frontline managers who are the most active participants in healthcare networks. You get a very different view of what's possible, and arguably you get a much different approach to innovation because it's more problem focused rather than what does this organisation do and how do we stop us being torn in different directions. It's more what's the problem and how do we solve it, and then the problem becomes how do we convince our managers and people higher up the chain to buy into the change that we're trying to achieve. But we start with a much more problem focused discussion. So for all those reasons, I think supporting healthcare networks is really, really important. I think the Health Foundation is doing a very, very brave and interesting thing in pushing this programme. And I think we've always started to see, kind of, even with the CLAHRC network, started to see kind of real change coming out of the support that's been put in.
Working with the Knowledge into Practice network has been very helpful at moving that forward in a more formal way. The piece of work that I did involved getting geriatricians, academic public health, GPs and the wider community interested in how we can join things up together. So a network is the obvious forum for doing that, and there were a lot of spin-offs. One spin-off that I was really quite unexpected was having found out some information on how you can use community radio to put out ideas in health. I put that out on the network, and what came back in the end was a manager from a local trust, and now there are networks forming from networks with the various radio stations working together with health to promote healthcare messages right across Leicestershire County.
The event that I spoke at was really rewarding, quite challenging in a lot of ways. In that I'm used, of course, to speaking to my peer group, as academics are. I'm used to framing things in particular ways, but it was very good to give a presentation which was about how organisational change is sustained and embedded in healthcare, and then to listen to people whose views I probably wouldn't really usually hear about what I'd said. They gave me new ideas, they gave me new challenges, they made it clear that there were one or two things about the practice concepts that I'd misunderstood. And all of that input was just really valuable and was something that I don't really know, I can't think of many other ways in which I could have got that.